Hey everyone, it's Dr. Follicle and welcome back to the Scalp and Hair Care channel. Today's video is about something quite close to my heart, and that is hair loss on the scalp due to seb derm. Seborrheic dermatitis is a common scalp condition that can contribute to hair loss, excessive flaking, and inflammation. While it doesn't cause permanent baldness unless left untreated, the irritation and oil imbalance it creates can weaken hair follicles, leading to temporary shedding and thinning. Fortunately, there are effective natural and medical treatments that can restore scalp health and promote regrowth. In this video, we'll cover the causes, symptoms, and the best treatments, including MCT8 oil, squalane oil, manuka honey, exfoliating acids, scalp steaming, and dermarolling for optimal scalp health. Seborrheic dermatitis is a chronic inflammatory condition affecting oily areas of the skin, particularly the scalp, face, and chest. It is linked to overproduction of sebum scalp oil, a Malassezia yeast overgrowth on the skin. The yeast is naturally present but can become aggressive and thrive out of control. Flaky, greasy scales and redness, itching, irritation, and sensitivity. This condition disrupts the scalp's microbiome, leading to inflammation around the hair follicles. When left untreated, it can cause excessive shedding known as telogen effluvium, weaken hair roots, making hair appear thinner, and prolong scalp irritation, delaying regrowth. However, with the right treatment approach, hair loss from seborrheic dermatitis is reversible. How do I know? Because I have personally gone through hair loss from seb derm myself and slowly recovered lost hair. Malassezia yeast feeds on certain fatty acids. Malassezia thrives on long-chain fatty acids found in some oils, oleic acid from coconut oil and olive oil. Instead, use medium-chain triglycerides MCT8 oil, which Malassezia cannot metabolize, reducing yeast growth and inflammation. Topically apply a small amount onto the affected area once daily. MCT 10 and 12 are also available, but are closer in chain length to the fatty acid that yeast feeds on. My advice, stick to MCT8 only. Link is in the description below. Excess sebum and scalp imbalance, overproduction of oils, trap dead skin, creating an environment for yeast to multiply. Squalane oil is a lightweight, non-comedogenic oil that can balance scalp hydration without feeding yeast. Please note, squalane, not squalene, is advised in this situation as they are different. Scalp inflammation and irritation. Inflammatory responses lead to weakened hair follicles and increased shedding. Manuka honey has natural antibacterial and antifungal properties, reducing inflammation and restoring scalp health. Poor scalp exfoliation and product buildup, accumulated dead skin, excess oil and hair products, clog follicles, worsening the condition. Exfoliating with salicylic acid and glycolic acid helps dissolve flakes, unclog follicles, and promote hair growth. Lack of circulation and scalp stimulation. Poor blood flow to the scalp reduces nutrient delivery to follicles. Scalp steaming and dermarolling can improve circulation, boost oxygen levels, and encourage regrowth. If your hair is thinning due to seborrheic dermatitis, you may experience itchy, flaky scalp with yellowish-white scales, excess hair shedding, especially during flare-ups, red, irritated patches on the scalp, and thinner hair in affected areas but no permanent bald patches. The good news: hair loss from seborrheic dermatitis is temporary once inflammation is controlled. To stop hair loss and restore scalp health, focus on reducing inflammation, balancing oil production, and nourishing hair follicles. Medicated shampoos to control yeast and oil. Ketoconazole shampoo like Nizoral 1 to 2%, a powerful antifungal that reduces Malassezia overgrowth. Links will be down below on the products I advise. Zinc pyrithione, found in Head & Shoulders Clinical, soothes inflammation and fights dandruff. Selenium sulfide, such as Selsun Blue, slows down yeast growth and oil production. Salicylic acid, like Neutrogena T-Sal, exfoliates dead skin and unclogs follicles. Use these shampoos 2 to 3 times per week. Cycle them so that the yeast does not get immune, leaving them on the scalp for 3 to 5 minutes before rinsing. One thing we will talk about in another video is how to break down the protective biofilm that needs to be penetrated before the yeast can be killed. Natural and hydrating treatments. To recap: MCT8 oil, or medium-chain triglycerides, hydrates the scalp without feeding yeast, unlike coconut or olive oil. Squalane oil is lightweight, non-greasy, and ideal for scalp moisture balance. Manuka honey, a powerful antibacterial, anti-inflammatory, and helps with scalp healing and microbiome balance. Scalp exfoliation and deep cleansing. Glycolic acid 5 to 10% gently dissolves dead skin, preventing buildup. Salicylic acid 2% helps remove stubborn flakes and reduce scalp redness. Use exfoliating treatments 1 to 2 times per week for optimal results. Scalp steaming for better absorption. Scalp steaming opens up follicles, allowing treatments to penetrate deeper, improving hydration and circulation. Do this once a week before applying oils or treatments. 5. Derma rolling or microneedling to stimulate regrowth. A 0.5 mm to 1 mm derma roller improves blood flow and collagen production. Boosts absorption of scalp serums like rosemary oil or minoxidil. Use 1 to 2 times per week for best results. Lifestyle and diet for scalp health. Reduce processed foods and sugar as they can worsen inflammation. Increase omega-3 fatty acids found in salmon, walnuts and flax seeds for scalp hydration. Lower stress levels since chronic stress triggers flare-ups. Yes, once inflammation is controlled, hair typically regrows within 3 to 6 months. To speed up regrowth, use minoxidil or Rogaine, which stimulates dormant hair follicles. I will do another video on topical versus oral minoxidil, so stay connected. Scalp massages to boost circulation and promote stronger roots. Biotin and collagen supplements to strengthen hair from within. Seborrheic dermatitis is chronic but indeed manageable. By balancing scalp oils, reducing inflammation, and supporting healthy follicle function, you can restore scalp health and prevent further hair loss. Would you like a list of recommended products or a step-by-step scalp care routine? Let me know. If you're struggling with persistent hair loss or any of the conditions we discussed, don't hesitate to seek professional help or indeed ask in the comments section below. Thanks for joining me today. And don't forget to give this video a thumbs up if you found it helpful. And for more hair-raising insights, make sure to subscribe to Dr. Follicle's Hair and Scalp Care channel and hit that notification bell so you never miss an upload. As always, check in the description section of this video for links to some of the products we discussed today. Plenty of content coming soon, so be sure to stay connected. See you soon. Take care.